Welcome to The Buzz, where we bring you leaders in dental education, discussing hot topic courses and industry trends. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau, and today I'm interviewing Dr. Warren Jesek. Thanks for being here, Warren.
Hey, good afternoon.
Glad you're here. Now, Dr. Jesek's message revolves around comprehensive care for the entire family and a systematic method to delivering excellence with consistency. We're going to be speaking today about his course entitled Creative Treatment Planning. Warren, could you get us started by telling us what would attract dental professionals to attend this course?
Well, I think what you do is you get to see a clinician's journey over 35, 40 years almost now of what works and what doesn't. And what we really try to do is give our patients comprehensive dentistry, but we want to give them treatment plans that give them the utmost care and comfort and stability over a lifetime. And when I've been able to observe patients in generations, I got patients that have been with me for 40 years, but they've got their kids, their grandkids in here. And what really works? So you have to pay attention to occlusion, you have to pay attention to the periodontal condition, what kind of x-rays are you taking, are you doing a comprehensive diagnosis treatment plan, and then do you think ahead? I mean, do you really stop and look at somebody and you say, this person's going to live to be 80 years old. Now, what decisions am I going to make when they're 6 years old that will affect them for the rest of their life? And there's some little things about what do you do with deciduous teeth? What do you do with orthodontics? What do you do about keeping the temporomandibular joints healthy and happy? And so my experience with the Dawson Center and Pete Dawson and the Pankey Institute have really helped me establish a level of excellence within the practice that not only permeates the work that comes from my hands, but we develop an entire staff attitude of comprehensive dentistry that gives our patients, the ultimate in comprehensive dentistry and comfort and function for a lifetime. So it's really kind of cool because you get to look at life through my eyes, and I have spent my time looking at other dentists and looking through their eyes and how they've been taking care of their people for years, and they've told me what worked for them. And so I've run into a few dead ends at the end of an alley, and I've had some really good successes, and I've had my share of defeats. But my practice has always included everything from endodontics to periodontal treatment to oral surgery to implants. I've jumped all over CAD/CAM. I was an early adopter in CAD/CAM. I paid the price dearly in some areas, and I've got a lot of experience in the materials you can use. But really, this course is mostly a lecture. It's kind of show and tell. Here's a picture of this. You know what? And it's lasted for 30 years. And that's what the course is primarily about.
Wow, that sounds like it's got a lot of meat on the bones, right, so to speak, because you have all of those years of experience with, as you say, multiple generations and in such a wide range of areas, different specialty areas. So we talked kind of high over the top of the different topics. Could you take us just a little bit deeper as to what the attendee will learn while they're in there more specifically?
I think that when you have staff, especially bring staff to something like this, if they've been with the same dentist for a long time, or the same philosophy or same practice, a lot of procedures they haven't seen before, and it will expand their knowledge base in a discussion. And if you've got a neophyte employee or something like that who's just there, and you as a senior doctor really don't have time to expose them to all of your knowledge, what happens is this thing moves really quick. They'll say, oh, I didn't know somebody could do that. Oh, wow, that's really cool. Why don't we talk to the patient about that, doc? Well, yeah, I learned how to do that a long time ago. I guess I just never told you I'd do it. So that really brings people into it. And a lot of people are kind of like paralyzed about, can I really do this? And is it going to work? Is this, and I've got a thing I talk about fringe knowledge and core knowledge. And some of the knowledge that I talk about is core. And some of it's a little bit peripheral, and some's really fringy. And it helps. I've talked to a lot of dentists that say, Dr. Jesek, what do you think about this? I said, well, that's core knowledge. I mean, it's good stuff. And then somebody say, well, what do you think about this treatment? Well, you're taking a chance. Or I'll say, I did that years ago and it just didn't work. And probably the most classic example of that was I was a young man, I would double abut bridges. Doesn't work. They fail 10 years or something. Just a little. So they get to hear my failures. And I think you learn as much from failures and sometimes more.
Exactly. That does sound really valuable. So what I heard you say, as far as it sounds like it could be for the whole team even, would you say, or is it primarily for doctors?
I think it's I incorporate this lecture in with my other lectures when I lecture on cruises for 2 days, and I'll have a lot of staff and team there. And they really have a lot of fun with this part because it does. Like I've said before, you get to see it through somebody else's eyes, and it's really eye-opening.
Mm-hmm. Now, before we go, is there anything else that would be important for the meeting planner to know that we haven't already discussed about this particular course?
Well, you know, I take great pain in developing a course specific to whoever I'm going to speak to. I'll ask, you know, how much staff is going to be there, how many dentists are going to be, what size it is, you know, if it's, and then how I'm going to interact with these people, because I'll drag them in. I like using tents with their names on it, and there's a lot of communication skills that come in any lecture I do. But I will customize any lecture to fit the time from 2, 4, 7 hours, or even 2 days with a lot of knowledge. And it just, you kind of feed off who's there, and you ask them a few questions, and you change it a little bit. You don't just, I don't stand in front of the podium. I mingle a lot. I keep them moving around, and nobody sleeps. Go ahead.
You know, we get that feeling. I can just get that feeling from this conversation that it would be a fun course, that with your personality and your energy level and those years of experience, I can see where it would be a fast moving, probably pretty interactive course. So it sounds like a great one.
Oh, yeah.
Well, thanks so much for being here. Really appreciate you sharing information today about your course, which is entitled Creative Treatment Planning. And for the meeting planner that would like more information on this course and Dr. Jesek's other courses, you can visit dentalspeakersbureau.com, where you'll find his listing, his contact information if you'd like to reach out to him directly, or you can also reach out to us and we'll put you in contact. So thanks again for listening in, and until next time, be well.